Good morning, good afternoon, everyone. I'm really excited to be here today to talk about a career path that's often misunderstood but incredibly rewarding: public health specialty training in the UK. When people hear public health, they often picture lab coats, vaccination campaigns, or epidemiological graphs. But public health is so much more than that. It's about keeping communities healthy, preventing disease before it happens, and shaping systems that make us all healthier. Today, I want to take you on a journey through what it takes to enter public health, the structure of specialty training, and the kinds of careers that follow. By the end of this session, you'll have a clear understanding of the pathways into public health, what training looks like day to day, and why it's such a fulfilling career choice. Before diving into training, let's pause for a moment to think about what public health really is. At its heart, public health is about improving the health of populations, not just treating individuals. If medicine focuses on saving one patient at a time, public health is about building systems, policies, and programs that prevent illness for hundreds, thousands, or even millions of people. It's part science, part policy, part leadership, and sometimes a bit of detective work, tracking patterns of disease, investigating outbreaks, and figuring out how to prevent them in the future. So, why would someone choose public health when clinical work is already so demanding? The answer is that in public health, you have the opportunity to make a difference at scale. You could work on improving vaccination rates in a community, reducing health inequalities across a city, or influencing national health policy. And the field values diversity. You don't have to be a doctor. Nurses, pharmacists, allied health professionals, and scientists can all enter public health and thrive. In fact, having a range of perspectives makes the field stronger and more effective. Now, how do you actually get into public health specialty training in the UK? There are essentially two main routes. The first is the medical route. For doctors who want to become consultants in public health medicine, doctors typically complete foundation training and sometimes core medical training, and then apply for specialty training in public health. This is competitive but structured and provides a solid foundation in population health, health protection, and policy. Medical trainees often work on outbreak management, hospital infection control, or shaping national health strategies. The second route is the non medical route, which is open to anyone from nursing, pharmacy, allied health, or science backgrounds. Candidates generally need a relevant degree and some experience in health or public health roles. They may apply for specialty training through fellowships or programs aligned with the UK Public Health Register. The important thing to remember is that public health welcomes a variety of backgrounds. You don't have to follow a traditional medical path to make a real impact. So, what does the training itself look like? Think of it as climbing a ladder, each step building your knowledge, skills, and confidence. Typically, training lasts about 5 years. The early years, sometimes called core training, are designed to give you a broad understanding of public health. You rotate through placements in local authorities, NHS trusts, and public health agencies. You'll learn the fundamentals of epidemiology, health protection, and health improvement, while also working on practical projects like evaluating a community health program or analyzing local health data. Later in training, you enter higher specialty training, where you can start to focus on areas that interest you most, whether that's health protection, policy, research, or global health. You'll take on more responsibility, lead projects, mentor juniors, and present your findings to stakeholders. Training also combines academic study with practical experience. Many trainees complete an MSc in public health alongside their placements, and you'll be assessed through real world projects, workplace based assessments, and exams from the Faculty of Public Health. By the end of training, you'll have developed a unique set of skills. You'll understand how to analyze health data, translate evidence into policy, communicate effectively with communities, lead teams, and manage large scale projects. Imagine designing a vaccination campaign. You need to understand where risks are highest, how to reach communities effectively, and how to coordinate multiple teams to make it happen. That's public health in action. Once training is complete, career opportunities are wide and exciting. Many medical trainees become consultants in public health, advising local authorities, NHS bodies, or government departments. Non medical trainees can also progress into senior public health roles. Others go into leadership or policy roles within national health agencies, academia, or research institutions, where they can shape public health strategy and teach the next generation. And there are international opportunities as well, with organizations like the World Health Organization, or NGOS, tackling global health challenges. Essentially, a career in public health is flexible, varied, and impact driven. You can move between local practice, national policy, research, and global health, depending on your interests and goals. For those considering this path, a few practical tips can help. First, try to get experience early. Work in health promotion, epidemiology, or local authority public health roles to gain exposure to the field. Second, network. Attend events, webinars, and conferences, and speak with current trainees or consultants to learn from their experiences. Third, keep learning. Short courses, online modules, or an MSc in public health can strengthen your knowledge and skills. And finally, stay curious. Ask questions, explore data, and always consider how interventions impact the communities you serve. Public health specialty training isn't just about qualifications, it's about developing the mindset, knowledge, and skills to improve the health of communities. Whether you're a doctor, nurse, or allied health professional, public health offers a career where your work can touch thousands, even millions, of lives. It's challenging, yes, but also incredibly rewarding. If you've ever thought about stepping off the hospital ward and into a role where you can shape health at a population level, this path might be calling you. Remember, public health is about people, policy, and practice working together, and there's room for all kinds of healthcare professionals in this journey. Thank you so much for your time today. I hope this gives you a clear picture of what public health specialty training in the UK looks like, the pathways into it, and the exciting careers it can lead to. I'd be delighted to take any questions you have now,